Doomsday Virus. Coronavirus cases not boosting weekly death numbers yet. March 27th, 2020. So these are death numbers, weekly death numbers from the Centers for Disease Control. It's a single file, and it's data from 2013 until the most recent week for which they have data, which is the week ending Saturday, March 14th, 2020. These numbers are just put out today. Now this shows the current death rate, or death numbers. So in the week ending March 14th, 2020, 2,431 people were reported died from pneumonia and 365 from influenza or the flu. The same time last year, week 11 of 2019, the numbers were 3,979 deaths from pneumonia and 510 deaths from influenza, so much more. There's no sign in this data that the deaths are increasing due to coronavirus. Coronavirus is supposed to be much more deadly than the diseases diagnosed as pneumonia and influenza. So coronavirus's mortality rate is supposed to be 1.4%, maybe several percent. Different numbers are being thrown around. They're not necessarily all that reliable. However, a disease with this kind of death rate has a much higher death rate than any of these diseases classified as pneumonia and influenza. So the disease, the coronavirus, if it's unusually deadly, would quickly show up in these weekly death figures, assuming that they're accurate. So this is more detail on the data from the CDC and the National Center for Health Statistics. So let me explain this plot to make it clearer. On the vertical axis, this is the vertical axis here, we have the weekly number of deaths. On the horizontal axis, we have the date. We represent it as years, so this is data from 2014. The way we handle the weeks is, let's say you were halfway through the year, about here, you're on week 26. We take 26 and divide by 52 loosely, and we get 0.5, so we identify the week by digitally by 2014.5, for example. The green plus signs are the actual data from the CDC file. That data is supposedly up to date through the end of the week ending in March 14th, 2020. And you can see it's definitely seasonal. We have a model here, a seasonal trend model. That's the blue line, and just the trend is the red line. So we can see that overall, the average number of deaths or death rate, incidence, whatever, there are technical meanings for this term, but it's declining as the years go by, presumably due to better medical care and other causes. This model agrees with the data about 77% of the time. That's a sort of non-technical way of describing this number here. So if this number was 1.00, it would mean perfect agreement, 100% agreement, and the blue line would exactly fall on the centers of each of the plus sign markers. It's not perfect. We have spikes in certain years and falls down, overpredicts in some years, but overall it's a moderately good model. You can see that for this year, for 2020, since January, the reported number of deaths in the CDC file is falling well below the long-term trend and seasonal variation. There's no sign in this of a highly deadly disease, whether it's coronavirus or something else appearing, right? In fact, you can see the numbers have so far continued to drop each week. They're not going back up yet, as you would expect with a very deadly disease. The data comes from the CDC website, from the pneumonia and influenza mortality surveillance section. This text was not updated correctly, so it actually is claiming that the data is the week ending March 7th, but this is actually the data from March 14th. It's correct in the plot that they show. The data you can get to by clicking on View Chart Data. The red line is the rate, the percentage of all deaths due to pneumonia and influenza. My plots are showing the actual number of deaths reported. So that red line is supposedly just the data, or at least the rate computed from the data. And these black lines are a periodic model, a seasonal trend model of some sort that the CDC created. There are some caveats. So if you look at last week's file, and I have a video on last week as well, the number of deaths reported In week 10, that was the week ending March 7th, 2020, was 2,258 pneumonia deaths and 347 influenza deaths. However, this has been substantially revised upward in the new data. So this is not a small change, in fact. The new file gives 3,092 deaths in week 10, as opposed to 2,258. So it went up by over 800, a big change. And a fairly large change in influenza deaths, from 347 to 484. So that's actually more than 100. It's more than 25% increase. There are discrepancies and revisions in all of these numbers, though they're generally larger the last couple weeks. Here's what the fine print says about this data. In my opinion, it kind of says two contradictory things. So they say the following: to allow for collection of enough data to produce a stable, emphasis stable, pneumonia and influenza death percentage, NCHS surveillance data are released 1 week after the week of death. The NCHS surveillance data are used to calculate the percent of all deaths occurring in a given week that had pneumonia and/or influenza listed as a cause of death. So again, they say stable, so that implies that the numbers are probably not changing that much, almost certainly not as much as they did in this last week. They also say the pneumonia and influenza percentage for earlier weeks are continually revised and may increase or decrease as new and updated death certificate data are received from the states by NCSH. So it's not very clear how reliable this data is. The CDC, the NCHS don't appear to be putting out sort of systematic and statistical error estimates in these files that would make it easier to analyze it. So we're kind of guessing. It's pretty clear from that, at least the last couple of weeks, there's some large revisions occurring. We don't know why. I don't know why. And it could be from chaos associated with the current crisis. It could be that it's always that way. It could be a lot of different explanations for it. Even with those revisions so far, the data doesn't show any large uptick in deaths as we might expect from an extremely deadly disease, much deadlier than the typical pneumonias and influenza cases. So the coronavirus mortality rate is claimed to be unusually high. So numbers from 1.4% and higher have been reported. I think the numbers from China and Italy, at least for a while, were very high. This is much, much higher than the typical mortality rate for the diseases that are typically diagnosed as pneumonia and influenza. So it's a lot higher, and that means it should produce a lot of deaths. Mortality rate is presumably something like the number of deaths among people who are tested divided by the number of persons tested who test positive. Now, there are a lot of different tests. There's a lot of confusing reporting and so forth. It's not clear what the mortality rates really are. Sick, hospitalized, high-risk people are likely to be tested first. They're also likely to have higher death rates simply because they're very sick. Someone who's immune to coronavirus or quickly throws it off and doesn't have a lot of health issues isn't going to go to a doctor, isn't going to go to a hospital, isn't going to die. So the current statistics are not based on a cross-section of the population. They probably overstate the mortality rate for the general population by an uncertain amount. However, a few percent death rate, again much higher than the normal death rates we see with these diseases, should show up as thousands of deaths per week shortly, if it hasn't already. In fact, there's been such chaos, lack of tests, lack of awareness of the disease, that it would be surprising if it hasn't in fact reached the United States, killed people, and there ought perhaps already to be something visible in the data, but there isn't. So that's the problem. Basically, so far the data is not showing evidence of a really super deadly disease, much worse than we typically encounter. That can easily change, and it's likely that within, I would guess, no more than a couple months, we'll have much better statistics on deaths. They don't require the test. The test can be wrong. The tests cannot work. There can be all kinds of problems with the testing, but the bottom line is these things, this high mortality rate should turn up in deaths and death certificates. And the system for measuring deaths should be very mature. It's been done for a long time. And you would think that it would be very fast, real-time, computerized. It ought to be, because this is the surest way of detecting the presence of a new disease or cause of death that is much deadlier than what we normally encounter. So You would think the CDC and other government agencies would be very much on top of this. They would already have a system in place, and they would be able to see the death rate increase without any awareness that something like coronavirus exists. This is a legal disclaimer. You can read this here on this slide. You can also take a look at our disclaimer on our website, which I'll include in the show notes. The most important is the professional disclaimer. This report cannot and does not contain medical, legal, fitness, health, financial, or other advice. The medical, legal, fitness, health, financial, or other information is provided for general informational and educational purposes only and is not a substitute for professional advice. Accordingly, before taking any actions based upon such information, we encourage you to consult with the appropriate professionals. We do not provide any kind of medical, legal, fitness, health, financial, or other professional advice. The use or reliance of any information contained in this report is solely at your own risk. In addition, respiratory illnesses can be quite serious. They're one of the leading causes of death in the United States, number 8 on the list. They can kill you very quickly if you don't get oxygen for 4 minutes. This is the rule of thumb. It's not always true for everyone, but generally it's true. You will die. I personally had a respiratory illness that was never adequately explained, went to the hospital emergency room and had a number of treatments. It can be quite serious. You should seek advice and so forth from medical doctors and other legally licensed professionals, public health authorities, etc. This video was produced on Friday, March 27th, 2020, and it is based on the data from the CDC website that was put out today, Friday, March 27th, 2020. Be well, take care. Hopefully this crisis will blow over and hopefully will not be as serious as many fear. If you like this video, please take a moment to click like. Please click subscribe and the notification bell if you would like to receive more content from us. We welcome constructive feedback and comments. Mathematical software is developing products and services to automate data analysis, reducing the risks of costly errors and improving results. If you want to support our work, you can subscribe on our Patreon page. This is the URL for our Patreon page. Scan the QR code in the lower right corner with your smartphone to get the Patreon link. Our Patreon link is also in the show notes below.